Good evening and welcome to a brand new episode of Health Check. My name is Grace Mutiso. Glad to be with you. This is Hope TV, Look and Live. And on a brand new episode, we begin in a big way with a big topic. So we are excited and we're looking forward to interacting with you and having a great session of learning. Now, let me give you some information. Now, according to World Health Organization, health literacy implies the achievement of knowledge, of level of knowledge, personal skill, and confidence to take action to improve your personal health. In addition, the Patient Rights Charter here in Kenya says that every person or every patient has a right to follow the following things. Number one, you have a right to information. And here, you as a patient, you're entitled to receiving full and accurate information about your health and your health care. Secondly, you have a right to be informed, to get informed consent to treatment. Here, as a patient, you're entitled to full and accurate information in a language that you understand, and in a language that you understand, informing you about the nature of your illness, diagnostic procedure that you're to go through, and proposed treatment. And finally, you have a right as a patient to receive a second medical opinion from the first that you've received. That is eye-opening, I believe. So as a patient, what do you need to go when you go to hospital? Is it just enough to see the doctor and take what the doctor has taken you, or you have a right to ask a question? That will be our focus for today on Health Check, and you're looking forward to interacting with you. Our SMS line is 22232. That is 22232. We are live on Facebook and YouTube. You can drop there your question and comment. And today, our topic is health literacy and numeracy. Health literacy and numeracy. Big terms right there. Allow me right now to introduce you to our guest to help us with that. His name is Dr. Sospeter Gatobu. He has a PhD in health studies and he is a gerontologist. Hey, I had to say that slowly, Doctor. How are you doing?
Thank you very much. Don't stumble on the term. It's not that. It's gerontologists.
You know, I had to say gerontologist.
Yes, yes.
But it's okay. We are glad to have you on our first session of Health Check. Kindly take some time to introduce yourself, some more what you do and what are you passionate about before we get to the topic of health literacy and numeracy. I'm sure most of our viewers are hearing about this for the first time.
Thank you. My name is Gatobu, Sospeter Gatobu. Like I've just said, my passion and my area of interest is health literacy, health numeracy, and the whole area of aging. But I do research on many things. I do research in education. I do research in health and development. And I'm based in Canada, but I'm a Kenyan. I've been here, I lived here. I just went to study in Canada and decided to stay there as my children go to school. So I'm here most often. My parents aged and they're going through what I'm talking about. So I've got lived experience even as we talk about this. And so it's exciting to be here. I've fellowshiped in this church. I'm a born-again Christian. Amen. So I am glad to be here.
Okay.
Thank you.
Karibu sana.
Asante.
So let's start by breaking down what is health literacy and numeracy.
Okay. First of all, from your introduction, I picked a few things. What you mentioned is part and parcel of health literacy and maybe health numeracy. But health literacy basically is how you are able to access health information, to communicate health information, to communicate it and to use it. So you are able to access it. You know the sources where to get the information. And you're able to analyze it and say, is this all right? Is it okay? What levels do I want to go to? And then you're going to use it for yourself and those around you and even the community. Sometimes most of us make decisions for people around us and even the community where we live.
Yes.
So that knowledge, that skill is a distinct skill set that is called health literacy. Health numeracy is about making sense of numbers in health contexts. And that is interesting because health information mostly is provided in numbers. Yes. We know it. If you go to the doctor, they're going to tell you your blood pressure is 80/120. They're going to tell you your BMI is 24 or something like that. They're going to tell you your twins being obese based on numbers, or your pre-diabetic based on numbers. But how many of us are able to understand those numbers? And do we even care? Interestingly, also, it's that sometimes, even when you go to talk about numbers, like if you go to, I come from Meru,
Yes.
and we know number 1 up to 10. 1, 2, 3, 4 up to 10. We don't have half in Kimeru.
Oh, really?
No. In Kimeru, no. And in most of languages, they don't have what we call exact quantities.
Yes.
So when you go out there and you're telling people you've got 50% chance of getting into an accident, what do they hear? And the percent bit is not in their language. Well, most people have been to school, but let's not forget, most people, research has shown, most people who go to school, if they drop out of school and go back to the village, they regress to their mother tongue.
Yes.
Or to Kiswahili.
True.
So you're here giving them information in English or translated from English, but it has got the same concepts from English. So are they really understanding it? And this may sound interesting. In my research, I found that there's a tribe, there's a group of people in Southern America. They do not have number words concept for numbers beyond number 2. So if we're 3 of us here and they are counting, they ask how many people are there, they will say many.
Yeah.
Because they just say 1, 2. They don't have 3, 4, 5.
Oh, really?
So when you get someone like that and tell him to take 2 tablets every 6 hours, what do they hear? And so it looks like it is very far-fetched. It looks like it's very abstract, but it is right here. You've heard people asking, I'm being told to take a tablet every 6 hours. So in a day, I take 3 tablets. So why can't I take the 3 of them in the morning?
Once.
And that's it.
Yes.
That is a level of not being health numerate, because they are not understanding that this has a way that's been calculated so that the effect is kind of cumulative over time. But they just think, well, I can swallow the 3 of them and I'll be fine. And that is the complication we have. Most people are not health literate, even if they've been to school.
Yes.
And that is something I think we need to interrogate today.
It was interesting. You're sharing with me a story of of a lawyer. I want us to get to that just to give an example of what you're talking about when we discuss health literacy and numeracy. So could you give us an example of some of health literacy?
Well, let me give you COVID.
Yes.
For instance, a lot of information came around. But how are we interacting with that information? You see, there's something about people who don't know much, or people who have not been informed, or people without information.
Yes.
There's something about them that makes it very, very hard for you to reach them with any form of information, because they don't know. So information that comes from any angle, they will swallow it, they will take it. They will not be critical, because there are levels of health literacy. There's that basic one of just writing, reading, and basically functioning in just everyday situations. But there's that interactive bit where you access information, you look at it, you extract it, and you are thinking, how does this apply to me? And then you use it. So it's not just information out there. Most people are at the basic level. We just see information, we look at it, and we swallow it whole meal. I mean, it's like, this is it. And we get so confused and so confused and so confused, even if it's wrong information. We don't know how to critically look at it. And then there's that level of it, which is really deeper, where we are looking at this information and we are saying, where did this information come from? Who is the source? And that source, how credible is that source? So you're being critical and you're thinking about it. And if you even think about it, even as we interact with our healthcare providers, most of us have not reached that level. That's why we go to quacks in the villages.
Yeah.
Someone calls himself a doctor, but that guy never stepped beyond from 4. And they went to some clinic and sold some medicine in some pharmacy in the village. And all of a sudden, they're treating people. They're injecting people. But we have not been socialized to ask ourselves, this person, who is he? And where did he go to school? And what is this he's giving me? All those things. Remember, like I said, there are 3 distinct areas where health literacy comes into play.
Yes.
How we access and utilize health services, how we interact with the healthcare providers, and finally, the final bit is how we care for ourselves, self-care. Health literacy and health numeracy impacts all those three areas. And if you think about the area of accessing health information, where do we get it from? How critical are we with that information? Can we understand this information? And let me not position this as if it is just from the patient side.
Yes.
No. I also position it from the health provider side. So there are two sides. There's the health literacy skills of the patient, and there's the health literacy and numeracy skills of the healthcare provider. When they present this information, do they care that this information is making sense to the person they're talking to? In other words, are they presenting it in such a way that this person actually makes sense of it and is able to make decisions based on this information?
Yes.
So that's the responsibility of the healthcare provider.
To explain it in a way that the patient will understand.
Exactly. First of all, what information is it? Is it credible?
Yes.
And then explain it to the patient. Remembering that this patient here has this, like you said, read earlier, they have got their own rights.
Yes.
But for some reason, the relationship that we have mostly is that the doctor is up here and the patient is down here. It's a power game of sorts. It's not very positive to say it like that, but that is why it is. Because you've gone to see a doctor, you're cowed. First of all, you're worried. You don't know what you have. And your intention is to communicate your feelings and what you're feeling in your body and everything. The doctor is supposed to make sense of that and diagnose it and tell you what they think.
Yes.
And mostly it is gospel truth, because most of the times you don't want to ask. You don't want to ask, why do you say like that?
Dr. Gatobu, for us, we want, just sort us out, we leave.
Yeah, but the being educated, what I think we need to remember is that this is our body. This is my body.
Yes.
I've come to the doctor kind of to trade information, but I don't have much to go by because I don't know much, even about my own body. So what we have done is like we have given the doctor all that responsibility. Okay, here I am, sort me out. Or that's all I want you to do. But people are even so worried and scared or even going to seek a second opinion because they don't want to offend the doctor, their doctor, my doctor.
Yes.
So that relationship there, I think we need to reach a point where the doctor and the patient, when I come to see a doctor, we are in a partnership, sort of speak. And even if I go out, if I tell you, thank you very much, doctor, let me find out what I have, I'll come back. Without this doctor being spited or that you're intimidating or you are threatening or something like that. But of course, we need to remember, and I don't think everyone is like that. We also need to remember the business bit of it.
Yes.
Where they're thinking this customer is going to go away. But I think it shouldn't be like that. That's where it has gone. But let's come back to health literacy and health numeracy. The people who have got low levels of health literacy, they have, there's some, we can say, as far as their health is concerned, they present with more sicknesses. They visit doctors more often. They stay in hospitals longer. They spend more in hospitals. They do not take care or do not take preventive services, right? Yeah. So they do not go for pap smears or tests or that. Of course, again, as I say this, I need to remember there's the socioeconomic aspect of it. There are people who may want to, but they cannot afford. So yes, that can be there. But by and large, even people who are working may not want to go for medical tests, which are preventive, because some conditions that we go through, if they are caught early, they can be treated.
Yes.
They can be managed. But normally, most of us go to see the doctor when it's too late. You go to see a doctor and you are at stage 4 cancer. Again, with things like cancer, we need to remember that even the doctor can miss it. But at least being sensitive. Remember what I said, the fact about self-care,
yes,
and then accessing and utilizing health information and health services. Being conscious of that, being able to manage your body and manage that space helps you a lot.
Okay.
And people with low health literacy and low health numeracy have a problem with those services.
Okay.
If you've got low health numeracy, of course, you'll have problems with appointments. If you're told, come after 2 weeks, unless someone is there to write something for you, Again, it also depends on the patient. There are people who are not learned. There are older people who forget, and there's all that. But like we said earlier, how do you make sense of that label on the grocery? The cereal, energy, calories, what? What do you make sense of those? I mean, that tells you that right there we have a problem with health numeracy. We can't make sense of those numbers. Yes.
The other day, I was taking a loved one to the hospital to go through a procedure, and you're told, fill the form.
Yeah.
So I said, no, I need to find out what is this saying.
Yeah.
And the health worker was really offended.
Yes. Yes.
Why are you asking? Just sign the thing, and we proceed on. So what you're talking about, our dear viewer, today is what do you need to know? What information do you need to know? What's your right? And in terms of numbers, if you're told your blood pressure is this over this, what does it mean? And how do you interpret that? And how can you use that to ensure that you're healthy? And please feel free to write your question to us. Our SMS line is 22232. That is 22232, 22232. We're also live on Facebook and YouTube. The handle is at Hope TV Kenya. We'll be getting to your questions in a short while. Our focus for today, we are talking about health literacy and numeracy, and I'm hosting Dr. Gatobu. So, Daktari, we've talked about all this, and a viewer could be wondering, so what is Daktari saying? So I've woken up, I'm feeling unwell. The first thing is I need to go and visit Dr. Gatobu. So here I am. For me to ensure that I'm literate, I'm competent in terms of health literacy and numeracy, what is expected of me? Let's give practical things. Now we are at your office. What is expected of me, and what is expected of you as a doctor?
I think there are those expectations. Of course, the expectation is that I know what I'm coming here for. I know what I'm feeling. And the expectation is I'm going to present this information to the doctor, and the doctor is going to come to a conclusion, diagnose what my problem is. That basically is this interaction with the doctor. That's where it is. The challenge is this interaction that we have with the doctors here, we've never been trained how to handle it. No one in the whole of our education system, we've never been trained in health literacy. It is a distinct area. It's a distinct skill that needs to be taught to all of us. So by and large, we don't have it. That's the whole point. If you look at what was happening in COVID, you know that we don't have that health literacy. We were bombarded with information from every corner. And we are running up and down. The government was running up and down. We were running up and down as the population. We didn't have that. So as you go to the doctor, I think the thing that I need to clarify here is that this is a skill that it does not just come because we went to school. It needs to be acquired, so to speak, so that you're interested. I'm not saying that you become an expert, but at least you need to have the basic ones. What questions do you need to ask when you interact with the doctor? What does the doctor need to know to have that meaningful interaction with the patient? That's what we are talking about here, which is by and large not there. I've seen that some universities actually are teaching health literacy to medical students now. And it's become an area of studies, an area of research and all that. But the general population has not reached there. So we're still in the woods where it comes. So until we reach such a time that we are able to educate the population that, hey, this is what you need to ask you. You need to know 1, 2, 3 things. You need to at least have some basics and some confidence to interact with the doctor and be able to know what they're doing with you and what you should expect from them and what they expect from you. And to know that you are together. Why? Because at time right now, most people are actually self-treating themselves, so to speak. They just go to Google and put their symptoms there and they say, oops, I've got a headache. I don't know where that headache is coming from. They Google and again. They are confusing themselves because they're not learned. But some of the doctors are doing the same. I've been to a doctor who actually Googled what I was telling him. He didn't think I was seeing, but there was a mirror behind him, and I saw him putting all my symptoms there. And the Google doctor brought in the symptoms. So there's a sense in which many people are taking charge of their health. And actually, before they come to see the doctor, they pretty much know what is there. But it doesn't have to be hidden. You know what I mean? It needs to be in the open.
Yeah.
that we are journeying together with the doctors. And so as we interact, it doesn't have to be intimidating. No one needs to be scared of going to see the doctor because the doctor is going to be just there, scribbling things and passing papers. No, they are going to engage with the patient very meaningfully and to be productive for both of them. And then they will journey through the treatment and the management together. But the patient needs to play a role in all of this. But they cannot play a role in all this if they don't know.
So what is the practical thing, Daktari, I'm asking that Grace as a patient, for example, can ask? So I've said headache, eyes are itching, Then you've prescribed, okay, I think it's a migraine.
Yeah.
So what are some of the practical questions you're expecting me to ask?
Maybe she could ask, what causes migraine? And how do you know it is migraine? Could it be something else? Doctor, could it be something else that we have not looked at? Do all migraines behave like this? And this medicine you're prescribing, what is it going to do to me? Does it have any side effects? What happens if I've got some adverse side effects? You see, those discussions are good because even maybe the doctor has not thought about it.
Yes.
And maybe, again, with this kind of information, the doctor will be careful to prescribe some medicine if they don't know the medicine. If, for instance, a big pharma came and gave the medicine and said, try it, the patients will be able to ask those questions. That's why we talk about even pharmaceutical health literacy, by the way.
Yes.
Being able to make sense of medicine and information about medicine and ask pointed questions about the medicine to the doctor and say, you've given me Panados. And what does Panadol actually do with my body? And what if I take a lot of it, what is it going to do to me? And the doctor should be comfortable enough not to feel intimidated or put down to say, actually, if you take a lot of these things, it can even mess with your liver. So how many should I take? And when should I know that my liver is getting affected? And how will I know anyway?
Yes.
You see that kind of discussion where you're not just sitting there and take this, and then you go away, and then you come next week with a serious headache, and the doctor changes all that because the medicine did not work well. But it could have been anticipated. You could even at home, you'd have taken 2-3 times and say, the doctor said I'm going to have a bad headache. Then you stop and come back and say, you know what you said has happened. So what do we do now? So there's a partnership there. There's a relationship there. But mostly people will go through it like my mother. My mother is going through some treatments right now. And so I call her and I say, Mom, what's happening with that swelling that you had? The doctor gave me medicine. I said, and how is the swelling? It's not gone. But have you gone back to see the doctor? No. I'll wait until the appointment. He said, I come after 3 weeks. I'll wait until the appointment. I said, no, Mom, just go. No, I can't go. He said, I come after 3 weeks.
Yes.
That's a discussion I've had with my mother. I'm not creating a story.
Yes.
And so you can imagine that in the way she's been socialized, the doctor said, and that's it. So that's what I'm saying. I'm trying to say, as Grace goes to see the doctor, did you call Grace?
Yes,
that lady?
yes.
As she goes to go see the doctor, that confidence that this is my body, and I can ask any question I want, and the doctor needs to answer them. The questions. I'm not intimidating her, the doctor. I'm not fighting with the doctor. I just want to know because this is not his body. It's my body.
Your body.
And so whatever is going to happen from whatever he's going to do is going to happen to this body.
Okay.
Yeah.
Does that include, why are you giving me 3 times a day and not one time a day?
Exactly. Exactly.
Or why are there so many?
Exactly. Yes.
Can it just be one?
Exactly.
Why not injection? Why tablet?
That kind of taking control of this discourse and knowing that you're working together. That is not, you're not throwing your body to the doctor to do it wherever he wants and then voila, you are healed. But it's like we are working together in this. And doctor, this medicine is not working the way it should. Why not? And I think for me, with a very informed patient, we are also going to have more informed and more careful doctors.
Yes.
That's my thinking.
Okay. Before we go to break, I would like to ask, what has caused low health literacy in Kenya, and what can be done to improve that? Because you've given an example of COVID. For sure, COVID, all we were following was this number of people, numbers, these have been found positive, these ones, they have passed on these ones are recovering. And the rate of infection is 10%. Mask, all that. So where are we as a country? What do we need to do?
Actually, it's a good question, that one. And you just mentioned numbers again, the rates of infection and all that.
Yes.
So what did that mean to the local person in the village? The rate of infection is 1%.
Yes, my mother in the village.
What did that actually mean to the person in the village? And not even, I think we are going very far. Even among some of us who are educated, what does that mean, 1%? Is it 1 out of all the millions? Is it 1 out of 10? Well, how do we conceptualize that? I mean, it's not an easy thing. But you asked a question about health literacy and the levels. Let me say this. The health literacy are not low in Kenya only. They are global. The Africa, for instance, I seem to remember there was a research that was done. I think we are at about that, I can't remember whether it was 35% or that 7% health literacy in Africa, among the countries where the research was done. Which was, I don't think we could generalize it, but it was done in a few countries. I think 14 countries or that. But it was a bit low. The highest was Namibia, and the lowest was, I think, is it Mauritius or Mauritania? I can't remember very well.
Yes.
But the health literacy is low all over. What is the cause of that? One, of course, it's never been deliberately attended to. It's not something that just comes. It is something that needs to be planned for. The US is doing that a lot now. There are many states where the health literacy is low, and they're trying to do all things, being very deliberate in planning for it, educating the healthcare providers about the need for health literacy in their service, in providing the health service, educating the population about what we are talking about now, developing materials deliberately, developing materials that are in line with the people's literacy levels, so that you're not speaking above them. Most of the information that we see, that we are giving to people, is way above their levels of reading. And there's a small bit, I don't know whether you've ever noticed in Word, there's actually that statistic about the reading level. I don't know whether you've ever noticed. When you do your spell check on Google, on Word document, if you've actually ticked the options, all those ones, you're going to see what level you're writing at. And most people, and I believe that we write at very high level because of what we went to school through. I mean, remember those compositions we used to write? We had to impress. We had to write bombastic language, you know? You write a word that is from a full line because you want to impress. In fact, I remember in high school, if the girls were coming to visit the school for whatever reason, there are those of us who would go and borrow the dictionary, the biggest dictionary in the school, and walk around with it. And debates we used to use. So we basically write to impress, not to communicate. Most of us. There are people, when they talk, they are just impressing. They use very hard words just to show how smart they are. But they're not communicating. Here is my rule as a trained communicator. I'm a trained teacher, I'm a communication also expert. If I'm writing at a level that I know a grade 8 cannot make sense of it, then I know I've lost everyone else. Because here's my thinking. If you hit the lowest, then everyone up here will understand it.
Yes.
If you hit that, then everyone down here will not understand it. So what's the point? So we just go for the lowest, the A's and worst. You can be simple without being simplistic, and then you are able to communicate with all these people. But if you aim for the professor up here, then you have lost all this. And so even as I write, if you look at all my documents, I'm usually very careful. I always try to avoid multisyllabic words. If a word has got more than 3-4 syllables, I will think of another word to use.
So like a doctor, if you're prescribing, make it as simple as possible.
Make it as simple as possible.
If this communication about health is to go to the masses, be in a language they would understand.
Yes.
Be in a language that is familiar with them.
Yes.
Okay.
Yes. So we have not, first of all, the education system has not taken this. The training of doctors and nurses and healthcare providers has not been deliberately on this. The materials we have developed have not been deliberate and intentional to reach everyone. Most of them are not even culturally appropriate because some of the concepts and everything in some cultures they may they may put them people off.
Give me an example of culture. You've said some of them are not cultural appropriate, like in Kenya.
Right. Let's say in Kenya, the whole area, most of our languages use euphemisms for everything, right? Even going to the toilet. You will not say, I'm going to the toilet. No, I'm going to, even in Kimeru or Kikamba, you will not go, I'm going to the toilet. And body parts, all of them are euphemistic. So you kind of think that because this thing is written in English, you can basically be that forthright in Kikamba. No, because again, it gets offensive. So there's cultural sensitivity in how we communicate with people. Have you noticed how easy it is for Kenyans to swear in English? Tell them to say the same things in their vernacular. They will not.
They will not.
I've tried it. Someone was using swear words, and I stopped him and said, would you like to say that in your vernacular? And the guy turned around and said, what? I said, yeah, what you just say it in vernacular. He couldn't. He actually laughed and walked away. He couldn't. So there's a way in which languages and culture align. And actually, culture and language are very together. So if you're going to present information, then you have to think about the culture. You think about how can this information be presented to this culture in a way that they are going to find it sensitive to them. Otherwise, they will not look at it once. They will leave it. And I used to work in the Bible world, Bible Society of Kenya, like I told you earlier. In the translation world, there are scriptures that they've had to change because some words are not appropriate. And they're in the Bible. So you can imagine if something is not appropriate in the Bible, you can imagine in the health domain when we are talking about body parts and all that kind of thing. So if the doctor wants to communicate, then they need to look at this person, they look at their age, they look at the culture and say, how can you communicate this properly?
Yes.
And again, it's not a power thing. It's a communication thing because they're journeying together.
Okay.
Yes.
Yeah. So what are the effects of low health literacy on patients and a very special category of people, the caregivers? You talked about you're passionate about, the aging, like our parents. So if they have that low literacy, in terms of health, what's the effect of that?
So the caregivers?
Yes.
So when you talk about the caregivers, are you talking about the health caregivers or you're talking about the home-based, like now you're taking care of your mother?
Yeah, let's talk about the care, you taking care of a patient at home.
Okay, that is home care. That is basically your guardian, so to speak. You're at home, you're taking care of a loved one at home. It's the same thing I was trying to say. First of all, there is, and I think this is something we need to discuss in another session because I think we need to have another session about home care and all that. The challenge that we usually have is that we can take care of a loved one at home. Remember, we are not trained to take care of the loved one.
Yes.
So my wife is sick, and I decide I'm going to take care of her. My mother is sick, and I'm going to take care of her. And so I bring her to Nairobi, to the house, and I'm working, and I'm calling from work, I'm finding out what the house girl is doing, who's not trained to take care of her. So are we helping her? No. We think we love her, but we're not really helping her. And what is happening? All of us are going down. The stress level in that home is going down because none of us is trained. So in some circumstances, it helps to get a trained nurse who can come and look at your mother and pray that law. She can come and check the blood, she can check the pressure, they can ask what's happening, they can give her medicine and all that. And so every day they come to check. That law needs to be developed. However, you can actually take a training so that if you want to take care of your mother or your loved one, then at least you're more informed about what is happening. But just jumping into it like that, it will hurt you more, or actually hurt both. I'll give you an example.
Yes.
My mother has been very strong, but she started taking care of my father, who has been up and down. My mother is now down. And these cases are that we are not trained, so emotionally or professionally, to take care of a loved one who is sick.
Yes.
So what happens is that both of us,
Fall sick.
we go down. So if the question you asked to answer it I've gone through a long process of answering it. The thing is just the same, the thing that we talked about. Let a person be exposed, let a person be trained if they want to, and let them know that there are many things they are not able to do or to know unless they are formally trained, so to speak.
Yes.
And be able to ask those questions we're asking. So, because now they become the surrogate, right? So when they take the mother to hospital, they're the ones asking these questions. This medicine you're giving my mother, what is it going to do to her? Why does she have to do that? Because she's the one who is basically making the decision about all these things. So she now becomes the quote unquote the patient and asking all these questions. And the doctor, that interaction is between the daughter and the doctor for the mother.
Yes.
And that the same interaction we talked about, there were those questions. Why the medicine? When should I take the medicine? What happens if it is reacting badly over there? And so on and so forth. How will I know that this medicine is even working?
Okay.
And things like that. Yeah.
Okay. Thank you. I'm talking to Dr. Sospeter Gatobu, helping us, on this topic about health literacy and numeracy. And I'm just wondering, my dear viewer, what has been your experience? I'd love to read about your experience. Have you been to the hospital and you're wondering, what has the doctor said? Again? Or you're the doctor on phone. He said how many times? And then you fear calling back, Daktari, I've not understood. What has been your experience? Or if you have any question or comment to Daktari 2232, that is 2232 is our SMS line. You can get in touch with us. You can also comment on our Facebook and YouTube at Hope TV Kenya. Allow us now to go on a break, Mr. Director. Is that okay? So and when we come back, we'll be able to hear a story about a lawyer who needed to get some health literacy and numeracy. Keep it Hope TV, look and live.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Welcome back to Health Check. My name is Grace Mutiso, and on Health Check today we are focusing on health literacy and numeracy, and I'm hosting Dr. Sospeter Gatobu, and I'm looking forward in the next few while to interacting with your questions and comments. And also I asked about your experience. What has been your experience, with a health caregiver? It could be a nurse, it could be a doctor, or if you are a health provider, what has been your experience with the patients who've come to see you? Do they take it in as you try to explain, or they have no interest, then they come back after a few days? What did you just say, Daktari? So interact with us on 22232, that is 22232. That's our SMS line at Top TV Kenya. That's our YouTube and Facebook handles where we are also broadcasting live. And remember to share this content with someone. Allow me to bring back Dr. Gatobu.
Thank you.
I promised after the break I would want to hear that interesting story of this great person, a lawyer. What happened to
It's another anecdote. Would you like to read it for us? Yes, it's just an anecdote that I kind of created.
Okay. Yeah, here we go. June was apprehensive. She had just come from her doctor's office to receive the results of the medical test that she had done a few days earlier. The doctor pointed to the many numbers of reports from blood pressure, blood cell counts, diabetes, BMI, and weight for height ratio Those are so many, eh?
Yep.
And then the doctor also explained that due to her age and many hours on the computer, she had a 30% chance of reduced vision. In addition, being an African, she was at risk, and he gave a number that she forgot of breast cancer, and that every 2 years she needed to go for comprehensive medical checkup. The information and the numbers were confusing, but she did not tell the doctor, and did not tell the doctor that she had no idea what the numbers meant. How could she tell her? She was a graduate and a senior partner at an international law firm. Then the doctor handed her a handwritten prescription with names of drugs she was to buy. There were more numbers, whole numbers, and fractions beside each drug. She took the paper and walked out of the doctor's office with many questions in mind. Outside, she remembered to pick some cereals and other food items for the family. As she got into the shop, she remembered the doctor's words: watch portions and servings with regards to your diet. I can almost hear how the doctor was saying. The doctor had insisted that she should henceforth start reading the following information on nutritional labels of the grocery packages. The label on the cereal boxes were intimidating. What is a cup? What is a serving? She wondered. How many cups should I eat? How about milk? Is 1 cup of milk the same as 1 cup of cereal? This is frustrating, she thought. She picked the items, paid, and got into her car and drove home. Then this hit her. She was illiterate as far as her health was concerned. She, a senior lawyer, was clueless when it comes to such an important area of her life. How could this be? What happened during all those years she spent in school? Can you relate?
Yep. Can you relate with that?
I can, Daktari.
Yeah, and that's what I was saying earlier. It doesn't matter whether you've been to school up to whatever level. This is a special area. It's a specific area of skills and knowledge that we don't have, all of us. I would not have known about it myself until when I went to do my PhD. And I remember I once asked a doctor, he was writing his prescriptions, and I looked at it and I said, I can read that. And he said, I was actually trying to see his reaction a few months ago, and said, what do you mean by that? I said, it's called health literacy. He says, what does that mean? I said, the fact that I can understand what you've written means we are communicating. And then he looked at me and said, really? I said, yeah. Then he says, we should be teaching that in school. Those are his words. And I think even as we continue, it's important for us to know that as patients, as the population, as individuals, we need to take control of our own health and the processes that go with it, the managing of the health. We need to be the one, not to cede that responsibility to someone out there, the doctor or the healthcare provider. When we can, a time comes when we can't. When we can, we do that. When we can't, then someone else has the authority to do it. Maybe our loved one, our spouse, or our child, or our son or our daughter. But so long as we are able to, then we need to ask ourselves, how do I take control of my life and my health and be able to make decisions, quality decisions about the medication, other processes that I need to go through. It just means we have to be knowledgeable and we need to have these skills.
Yeah.
Yes.
Okay. And let me take you back. Are there different types of health literacy, or it's just one major one that all of us need to know?
There are. There's mental health literacy, for instance, where you want to understand everything that is happening with the body. Remember, when you think about mental health, why we need to even think about it and talk about it more is because the culture, our language, our background in Africa, we do not seem to have the broad spectrum of mental issues or conditions that the Western world has. I'll give you an example. Shyness is supposed to be a mental problem. Just being shy. The same thing that causes you not to walk around naked, that is supposed to be a mental problem. And it is treated in the West. Here, no.
Shyness.
Shyness.
As in woga in Swahili.
Woga. Not even woga. Woga is a fear.
Yeah.
Shyness is not woga. Aibu, I think, to some level.
Yeah. Is it similar to shame?
Yes, yeah, shame. But you know, shame has got two sides. Shame, there's a positive side of shame. It is avoiding of shame that makes you not walk naked in the streets.
Okay.
And do other things. So there are those spectrums. They've got depression, manic depression, schizophrenic, blah, blah, all those things, and postpartum depression. In most of our languages, in Kimero, it is he's mad. Right?
Yeah.
And our Zimu, period. We don't have all these spectrums. And then in our thinking, most of the times, mental problems or mental conditions are spiritual. Amerogwa, the person has been bewitched. But we know that you can get mental issues from trauma. You can be hit. You can have an accident and your brain gets messed up. So are you still having a problem because you have been bewitched? Or what is it? When women have postpartum depression, is that Bashetan? Are those evil spirits playing with them? I don't know. There's that complication that we have there. And we need to know about it so that we are sympathetic and empathetic to people who are going through mental problems and mental conditions. And these are things that we need to start. And again, mental health literacy and its conditions and how to encourage others and to work with others who are going through these issues. We need to understand it. There's the environmental health literacy. How does the environment connect with our health? We know that chemicals that we've used on the soil are coming back to bite us. But do we care? Do we even know much about that to be able to be concerned and make it an issue? So there's environmental health literacy that we need to have. And it cannot be just anecdotal. It needs to be, again, front and center of our education. So that when children are going to school, they are learning that this chemical we are using, this chemical we are spraying on our crops is going to bite us back. It's going to come back to our own bodies and it's going to mess us. We're going to get all these diseases that come from it. How does the environment interact with us and our health? All right? And I think we need to get that, like I told you earlier, pharmaceutical health literacy. How much do you know about the pharmaceutical world itself, the medicine, the tablets, everything, and how they react with us? Are we very much informed? Do we know? Do we even care to say that some of the substances in the tablets we are taking may actually be very, very bad to our health? So that we are able to ask the doctor, this thing, I'm scared, I'm worried. What this is going to do to me, I'm really worried about it. And you know they write them in very small ratings that people are not able to read. And so that's what happens. Even when the insurance people come to insure us, there's a whole health insurance world that we need to be literate about so that we are able to interrogate and ask questions. And so we have all that. But we also have, like I said earlier, we have levels of health literacy. And like I said, there's a functional level. We are just talking about the basic aspect, reading, writing, functioning in every day. Then we've got the next one, which is basically not the critical one. I think I said it earlier. We have the function one, and then we have got the critical one where you go deep, and then we've got the integrative one, the interactive one, where you interact with the earth information. You are able to tease out what is necessary for you and use it. You're able to discard the rest. Then there's a critical one where you are thinking about the sources of the information, the credibility of this information, the credibility of the person who brought this information, all those things. And then you're also able to make a decision and say, I don't want that. Or I can pass this on to someone else, and I don't want this one to pass to. If you have got children, I don't want my children to go through this, though that is now analytical and critical at that level. And with the health numeracy, again, there's basic where it's just numbers. But then there's computational, where you are able to add, subtract, and things like that, and divide and all that. And there's the higher level, which is basically statistical. We don't need those things, where we're talking about risk factors and things like that. We don't need that. But at least we need to be aware that they exist. And also maybe be aware of people who know those levels, so that we can go to them and ask, the doctor said this risk, what does it mean? And because it applies to us, you may not be competent in it, but at least you can ask someone whom you know is competent. Or you can even Google it, so long as you know that you need to be critical about the numbers that the doctor has given you. Yeah.
Okay. You know, we've talked more about health literacy. We've not dwelled a bit on the numbers.
Okay.
So what are the critical numbers? You know, in Kenya we call them wanjiko. The basic one.
Yeah.
You know, mothers we are known to take care of, especially for our young ones.
Yeah.
You know, I just like, temperature 37, that's it. Run, Calpo, or a certain painkiller to reduce. So what are those numbers that we must look at and ask critical questions when it comes to children?
Okay, I need to make it very clear that I'm not a medical doctor, so that I don't get in trouble with my friends who are doctors. But basic things like temperature, of course. But I also read that it depends on where you have to put the thermometer. If you put it in the ear, it's different. The normal for the ear is not the same. The normal for the armpit and so on and so forth, under the tongue and other places that they put it. So I think that variation, so that when you have taken the thermometer, put it under the tongue of your child, and this whatever, you are panicking. But the doctor will tell you, that's normal because it was under the tongue, or it was in the ear, or whatever. So there's that range that I actually discovered during COVID myself. That kumbe there's a range, because everyone had a thermometer those days. Like everyone, my wife had two, one in the bathroom, one where, and she made me buy others, wherever I was to travel with. And I remember putting it in my mouth, looking at it and saying, whoop, I've got a fever. Yeah. Then I said, no, let me try the armpit. Look at it, whoop, I don't have a fever. And then I Googled it and said, kumbe, there's a difference. If it's the armpit, it's different. Another tongue is different, and so on and so forth. So you need to know these ones. There's also the BMI things that that tells you the fat around, especially the gut area, and that is not. People don't understand it very well. We are having a laugh at this. I've just come from Ethiopia, and they are saying men. Someone told me that I cannot be respected in some quarters because I don't have what they call success curve, or public opinion.
Public opinion.
And I was really trying to tell them, the problem is that is where your kidneys are. That's where your liver is. All that fat is dangerous. But no, you've got all this. And then I think you need to remember, apart from that weight, you need to remember that even your weight itself has got a lot of implications on your own body. For instance, the knees. Yes. The more heavy you are, the more weight you put on your knees, and the more problems you're going to have on your knees. So however much you look very healthy in it, it's okay. Small bits like that the calories I take in a day are important, but we don't talk about it a lot. In fact, one of the things that I'm wishing that we can get into policy here is that every food item sold in the supermarket should have the nutrition label, so that if I'm taking bread, I know that this bread, a slice, is not for every 100 grams. No, just per slice. Just so that, because most people don't have that weighing scale at home. True. So how about just saying one slice is 100 calories? So that I know when I have a bread, I've actually cleared 1,000 calories for the day. Wow. And that is even not good calories. That is bad calories. Yes. Things like that. And so we have talked about, then of course the blood, the 80, whatever, the blood numbers. How can we be educated about them so that we know? Again, it's just like accounts where we learn out of the school, but should these things be in school because it's alive? Yeah. Like now we're talking about CBC. Shouldn't these things be part and parcel of that learning that allows me or enables me to live a productive life? And so blood and diabetes, how do I know that I'm veering towards diabetes? And how can I be careful about it? Those numbers are important. Okay. And I'm sure the CD counts and all that the doctors have. But the main point for us is not to cram those numbers, is to be able to ask the doctor, what does that number mean?
Yes.
Yeah? What does it mean? You have told me CD count. You have told me that my hemoglobin is this. What does it actually mean? And when should I be worried about it?
Yes.
And what should I do about it? No, things like that. Not just, this is a number, here's a medicine. No. Maybe there are other things I can do to reduce this number. What are they? And that discussion needs to be had with the doctors.
Okay.
Yeah.
As we wrap it up, because we have a few minutes to go, allow me to appreciate Nalia Kambanda. Thank you so much for watching. You're saying you're loving the conversation. We appreciate you. Thank you so much. Also, Susan Kai, you're saying wonderful conversation.
Hey,
Thank
that's
you,
my
Doctor.
wife. She's
Great
living from
support.
Canada.
Thank you. Saying thank you, Dr. Gatobu, for your great insight. It's good to know you're watching. We salute you. Thank you so much. So as we wrap it up, Dr. what are some of the misconceptions you've had in regards to health literacy?
One of the things, actually the major one, is that I'm learned, I have a PhD, I'm health literate. That's a major misconception. I'm learned, I have a degree, so I'm health numerate. This major misconception. Those are distinct skills. Those are is a skill set that we need to acquire deliberately. It will not just come because we went to school. We need to pursue it. And the government also, and policymakers need to make it, they need to make it an item or an area that is informed by research. And I think the best thing is for us to, as a nation, to ask ourselves, what is the health literacy in this country? We don't know. I looked before this session. I hunted, I dug. I wanted to find out what is the health literacy levels in Kenya. Apart from these other countries that have done it, I didn't get an indication of what is happening here. And so, if we are going to push this country forward and have a mass of people in the population that are healthy, there are so many things we need to do. And I think if we use the education system to get young people with health literacy skills, I'm not talking expertise, I'm just talking about basic, so that they're able to do what we're doing, ask these questions, be able to interact meaningfully with the health services, be able to interact meaningfully with the doctors, be able to take care of their own health. Then we are going to have a bigger population with very good, or at least better health outcomes than we have. We will not be struggling so much to communicate with the population about their conditions or other conditions that may come. When COVID came, there was a lot of confusion because people did not have information. And even if they had the information, they did not know which information to go with. So there was a lot of information from everywhere and a lot of confusion. But had we had a population that is able to look at information and say, where is this coming from? And which source should we trust? And go to that source every time. And that source then becomes accountable because they're going to give you the correct information because everyone is looked up to you.
Yes.
And because, these people are critical. They will not swallow information that's everywhere. So if it's a government, they need to maintain a very high level of credibility so that everyone looks up to them. Remember, people always look at you as a source of information, how credible you are, how knowledgeable you are, how much they can trust you before they can take what you're telling them and use it. So if they don't trust you, then that's there. But basically, again, it is that exposure of knowing what to look for, where to look for it, how to interact with it. And remember what I said right from the start. We are talking about how we access and utilize health services, how we interact with the health care providers, the doctors and nurses, and how we care for ourselves. All that is impacted in our levels of health numeracy and health literacy.
Okay.
Thank you.
Wow. Thank you, Dr. Before I forget, what's the place of seeking for a second opinion when it comes to health literacy and numeracy?
It's a confidence. It's a confidence that you have, in my thinking, between the doctor and yourself, that you're not doubting or you're not saying he doesn't know. It's a realization, or rather the appreciation that you can't know everything, even if you are the doctor. Someone else may have an opinion. And because you're the only one here, in hospitals, you realize that they come as a pool. When you're admitted in the hospitals, they come as a group. They look at you, they talk about themselves, they say, yeah, she's presenting like this, and they walk away. But here I'm with the doctor alone. So he's all alone. So I'm basically depending on one person. So is it okay if I go and consult a bit and get second opinions? The doctor says, yeah, because that's what exactly happens in the hospitals. There are many, they consult and they talk amongst themselves about you. So what if now I go out and find this information and I come and say, hey, I saw the doctor and they said this possibility, what do you think? And then you start having an informed discourse or discussion with the doctor without feeling that it is insubordination. It's like you're challenging me, you're doubting me. No, I think it should be an open book there. That actually that's interesting. What did he say? Let's look at that, and then without feeling like there's any antagonism or conflict coming around. That's how I would look at it. The second opinion thing. I would like it to be a friendly thing, and always remembering it's my body.
Yes.
Right?
Yes.
So
yes.
I should have a second opinion, third opinion, fifth opinion if I don't want to, without you feeling that I'm throwing you under the bus or discarding you.
Okay.
Thank
wow.
you.
That's all the time we had. Thank you so much,
so much.
Sospeter Gatobu. It's been an honor. I hope we can host you again to talk about old age. That's a
Absolutely.
topic close to my heart.
Absolutely. I would love that because it's close to my heart more than you know.
Okay. Thank you.
Know. Yes.
I've been hosting Dr. Gatobu Sospeter. We've been focusing on health literacy and numeracy. I hope you have learned the same way I've learned to know that, yes, it's your right to go and see a doctor. Ask questions, Don't just take that prescription and say, it's okay, I'm sorted. Ask questions so that by the time you're leaving, that doctor's place, you are at peace. And it's your right to ask for the information. Before signing any document in hospital, it's your right to say, what is this medication about? What are the side effects and all that? And for you as a medical practitioner watching us, please be kind. Just explain. You know how much we love you. Yeah. Thank you so much. I've been your host, Grace Mutisa. It's a joy. See you again next week on Tuesday, 7:30 all the way to 8:30. Have a beautiful one and keep it Hope TV, Look and Live. In a short while at the top of the hour, we'll be having News Watch, so stand by for that. Bye-bye for now.